Hello everyone. We are from Group E, and we are going to presentate group assignment from organization and management. So this is the members of the group. There's Alia Fitriani Hutajulu, and there's me, Charlie Felicia, as the moderator today, and Nazwa Nurahma. So the topics we are going to presentate is the first one is chapter 1, Managing Today, about current event analysis. It's about policies and practices of gender-based equality and diversity in Australian project-based organizations. And chapter 2, the manager as decision maker, real-world decision analysis, about the impact of the Sri Lankan economic crisis on medication adherence. So policies and practices of gender-based equality and diversity in Australian project-based organizations. The summary is about the equality of the processes implementing equality and diversity practices of each organization and how the research systematically investigates how effective the implementation of those practices using a multi-case research method across 6 project-based organizations in Australian construction, property, and engineering in the industry sectors. The key points, the first one is decision making. It identifies the goals and objectives that are needed to be met by the organization, the processes required to be done to get set objectives and goals, and formulation of policies necessary for implementation. The second one is policy quality, is the process in which policies are identified to be effective or not based on their proposed and expected output and effect. The third one is practice implementation, is the process in which policies are identified to be either effective or not based on their actual output and overall effect, which may or may not establish a trend or work culture upon the workforce. And lastly, implementation quality is determining how effective the organization are at implementing said policies. So overall, this framework evaluates the Australian companies and organizations participating with the research. Detailed analysis. First one is the main issue. The relationship between gender equality and diversity practices in their impact on gender diversity in project-based organizations, or PBO, has delivered mixed research results. The challenges in this research is the findings reveal patchy and ineffective implementation of even well-considered high-quality diversity policies. The findings suggest that across all the case studies on PBO, also suggest that in some organizations, policies were linked to the diversity business case with a focus on improving staff engagement and productivity. And extend previous research by providing additional insights into how implementations affects the outcome of gender equality and diversity initiatives in PBO. The finding also reveals that in PBO, policies were linked to the diversity business case with a focus on improving staff engagement and productivity. The implications is the importance of the quality of design or selection of policies. The key concept is the implementation of gender equality and diversity policies. There's 4 stages of implementation, variation in policies and practices, challenges in implementation, measurement of outcomes, importance of effective human resource practices, work-life balance and work-life policies, strategic human resource management, challenges and opportunities in managing project-based firms, recommendations for improving organizational practices. So our group highly recommends taking the first step towards successful policy implementation by providing training for the line managers. It is important to understand that even though most well-crafted policy will remain nothing more than a theoretical concept or a piece of paper unless it is effectively executed and enforced by the organizations. Our next recommendation will be brought by Alia. Alia, the stage is yours.
Thank you, Charlene. Currently in Australia, there is a lack of legal guidelines that dictate the required percentage of female employees within an organization. As a consequence, companies have the flexibility to have female employees comprising a range of 10 to 30% of their total workforce. In light of this, we would like to recommend that the government introduce a new law mandating companies to maintain a minimum of 40 to 50% female employees in their workforce. This will ensure that women are provided with equal employment opportunities and help bridge the gender gap in the workplace.
Okay, that is all from the summary of the chapter 1, and we will continue in chapter 2, the impact of the Sri Lankan economic crisis on medication adherence. Please, Alia.
Okay. Summary is about the Asian adherence and online cross-sectional survey. This research is centered on the effects of the economic crisis in Sri Lanka on its citizens suffering from chronic illnesses. An online survey was conducted assessing the economic and health situation of the respondents from different areas of the country. The introduction to the scenario is chronic disease, lasting of year, demand ongoing medical care impacting daily life. They account for a major global health burden, causing 3 in 5 deaths, including conditions like heart disease, diabetes, cancer, and lung disease. Over a third of adults worldwide have multiple chronic illnesses, leading to high healthcare costs and economic strain. This burden hampers national and global economies and impedes effective disease management. Notably, a significant portion of coronary artery disease cases is expected in the Indian subcontinent, including Sri Lanka, with a population of over 21 million. In Sri Lanka, diabetes affected 11.3% of those aged 20 to 79, with 25% having metabolic syndrome and 23.7% having hypertension. This lipidemia affects over 75% of adults. These conditions contribute to coronary artery disease, the leading cause of death. Medication therapy can improve outcomes, but socioeconomic factors affect adherence. Non-adherence leads to hospitalization and mortality, with over 100,000 preventable deaths in the U.S. annually. Similar challenges exist in India and Africa due to economic constraints. Sri Lanka's current economic crisis likely impacts medication adherence. Evaluating adherence during this crisis can inform policy making and prioritize resources for better health outcomes. The next is detailed analysis. The first is decision-making process. The rise of chronic disease has become a major concern in Sri Lanka. Unfortunately, this has led to significant economic struggles for many Sri Lankans, as the cost of medical treatment can be quite high. Decision-making is typically described as choosing among alternatives. There is 8 steps that begins with identifying the problem, identification of decision criteria, allocation of weights of criteria, development of alternatives, analysis of alternatives, selection of an alternative, implementation of the alternative, and evaluation of decision effectiveness. The best choice of decision making is we need to assess all the alternatives and choose the other options that have the highest scores. The next step is decision implementation, which means that we will put decision into action. The next is some factors affecting the managers to make wrong decisions. The first is overconfidence. Second is immediate gratification. The third is anchoring effect. The fourth is selective perception bias. The fifth is confirmation bias. The sixth is framing bias. The seventh is availability bias. The eighth is representation bias. The ninth is randomness bias. The 10th is sunk cost error. The 11th is self-serving bias. The 12th is hindsight bias. The 20th is division bias. So, the key points and concept is the first, the economic crisis in Sri Lanka has had a negative impact on medication adherence among individuals with chronic disease. The second is a significant proportion of respondents and their family members had changed their medication use during the crisis. The third is switching to different brand of medication was the most common change reported. The fourth is respondents living outside the Colombo district and those with lower monthly incomes were more likely to change their medication. The fifth is the high cost of drugs and lack of access to medications in the public or private sector were the main reasons for changing medication. And lastly is the study highlights the need for interventions to minimize the adverse outcomes of poor medication adherence during economic crisis. So what we find from the results of our analysis is the first, the economic crisis in Sri Lanka has had a negative impact on medication adherence among individuals with chronic disease. A significant proportion of respondents reported change in their medication use during the crisis. The second is switching to a different brand of medication was the most common change reported by respondents. The third is respondents living outside the Colombo district and those with lower monthly incomes were more likely to change their medication. The last is the high cost of drugs and lack of access to medicines in the public or private sector were the main reasons for changing medication. Thank you.
Okay, thank you, Alia, for your presentation. And next, we will uh, tell you about the potential managerial decisions that could be considered and will be brought by Nazwa. Nazwa, the stage is yours.
Potential managerial decisions that could be considered. First, implementing measures to improve the availability of good quality medicine in sufficient quantities during economic crisis. Second is develop interventions to support individuals with chronic disease in accessing and affording their medication during economic crisis. Third is strengthening healthcare system and infrastructure to ensure the continuity of care for individuals with chronic disease during next slide. Evaluation of alternative. First, ask help from the World Health Organization for medical assistance. Second, finding investors to boost the economy. Third, ask other countries for an emergency loan. Fourth, reform the government expenditure. Fifth, promote government programs on self-sufficiency. Next slide. Hypothetical scenario. In 2025, Indonesia faces a severe economic crisis triggered by medication non-adherence. Despite a robust healthcare system, many struggle to follow prescribed regimens due to factors like limited health literacy and affordability issues. This leads to declining population health, increased hospitalization, and strained healthcare resources, impacting overall quality of life. The economic impact of poor medication adherence begins to manifest in multiple ways. First, healthcare costs. Second, labor force productivity. Third, pharmaceutical industry. Fourth, investor confidence. The last one is social welfare programs. The Indonesian government, recognizing the severity of the crisis, should launch the following initiative. Public awareness campaigns. Two, subsidize medication. Third, companies to lower medication prices and make efforts to increase the availability of affordable generic medication. Fourth, investment in a healthcare infrastructure. And the last one is economic stabilization measures. Group recommendation. As representative and servant of the people, leaders should prioritize the needs of the people over personal interests and plan the nation's future with extreme caution and logical efficiency. Thus, our group recommends the following options. First, partnership with NGOs and aid organizations. Second, engage with international organizations. Third, regional organization. Fourth, healthcare system. Five, labor force productivity. Six, pharmaceutical industry. Fifth, sixth, investor confidence. And the last one is social welfare programs.
Okay, that's all from our chapter 1 and chapter 2. Thank you everyone for paying attention to our presentations.